The cardiac cycle. This is Dr. Larson's chart of the cardiac cycle. It's divided under 3 lines, one for the atrial pressure, one for the ventricular pressure, and one for the aortic pressure. This chart is to show the pressure changes of the vessel and the chambers as they relate to the opening and closing of the valves to affect the flow of blood through the heart. To understand this, you have to understand how the valves work. If you think of the valves as a set of French doors, if you're on the side pushing to open them, when you push against them, they fly open. On the opposite side, when you push back, they go closed. They don't swing all the way through and open the other direction. There is a stop. If you have one person on each side of the doors, whoever is pushing harder is going to affect that change. They're either going to hold them closed or they're going to force them open. To get started, we're going to first start with the atrial pressure curve. In theory, the veins have 0 pressure. The atria, since it's being filled passively by 3 veins returning to the left atria, it is essentially starting at a 0 pressure. As blood fills into the atria, it will develop a little bit of pressure, but at this point, the ventricle is also in diastole, so it is also sitting empty, not under contraction, and its pressure is also near 0, so the AV valve is actually open. This means that the blood is flowing directly from the atria straight into the ventricle, and the ventricle is filling passively. The ventricle will fill passively about 70%. At that point, the ventricle has enough blood in it, it has a little bit of pressure, and for the atria to squeeze the last bit in, it goes into systole. This small curve right here is the systole of the atria, where it's squeezing the last 30% of the blood from the atria into the ventricle. You'll notice the first indication on the axis for pressure is 40. The atria is well below this. This is occurring at 10 or 15 pressure. The atria goes into systole, squeezes the last bit out. At that point, the ventricle is full and ready to start systole. The pressure in the ventricle is now starting to exceed the pressure in the atria, which is empty, and completing its systole, and that will close the AV valve. The ventricle then, the AV valve is closed. If we think about the pressure in the aorta being an artery, we know that the pressure runs between 80 and 120 as normal blood pressure. So we know that the ventricle needs to get to a minimum of 80 before the next valves open. So both valves are sitting closed and the ventricle is under pressure. This is the beginning of ventricular systole and the first phase of ventricular systole, which is the isovolumetric phase. That is where the pressure is building in the ventricle to the point that it can surpass the pressure in the aorta to open the valves. This pressure jumps very quickly. As you can see, the dotted line is a quick rise. As this happens, it will put a lot of pressure in the AV valve, which is lower in the heart than the semilunars. That pressure in the AV valve, it does not cause the valve doors to open the other direction, but it will cause the valve to push up into the atria a little. That is this little bit of increased pressure in the atria while the ventricle is pushing hard against the AV valves. After this ceases, the pressure in the atria will drop and it will return to its normal pattern. To support the AV valves, that's the chordae tendineae. If you think of them like tie downs to a car, on the roof of a car with the wind blowing underneath it, the chordae tendineae just hold down the AV valve to keep it from prolapsing into the atria. The chordae tendineae are linked into the papillary muscles, which are actually part of the ventricle wall. Since the ventricle is now in systole, they're actually using as a gripper to hold those down. Now, if we pick back up on the ventricle, it's under quite a bit of pressure and it skyrockets up, and we finally hit somewhere above 80. When this happens, it will surpass the pressure, the minimum pressure in the artery. The pressure in the ventricle is now greater than the pressure in the artery, and that will cause the semilunar valve to open. As the semilunar valve opens, the blood that is in the ventricle will shoot. It will eject and start to go into the aorta. We're now entering the second phase of systole for the ventricular systole phase, and this is called the ejection phase, where the blood is ejected out of the ventricle and into the artery. As this occurs, you can think of his image with the water bottle. Pressure rises greatly. It's pushing on the pressure of the artery, so the pressure in the artery rises with it. And as the blood when you start to empty the ventricle, the blood will start to taper and trail off. That will taper a little in the artery, but it will taper quicker through the ventricle, crossing back over to where the ventricular pressure is now slightly less than the pressure in the aorta or the artery. The pressure in the aorta being greater than the pressure in the ventricle will cause that semilunar valve to close. As the semilunar valve closes, the ventricle ceases systole and goes into diastole or rest. With the valve closed, the ventricle near empty, and the ventricle at rest, the pressure in the ventricle will drop quickly, surpass, become lower than the pressure in the atria, come down near zero. When it passes the pressure in the atria, the AV valve will again open, and the ventricle will start to refill passively once again. The last phase, we'll come back up here and we'll track the pressure in the aorta. We've seen where the pressure in the aorta reached our maximum near 120. It tailed off a little bit, but it stayed higher than the ventricle once the ventricle stopped systole and was emptied. So the the semilunar valve is closed. The pressure in the artery is near 120, but now that the ventricle is not in systole and is no longer ejecting blood, causing the pressure in the artery to continue, the pressure in the aorta will now start to drop, with one little oddity to it right here. And that is that during the time of the ejection phase, which is approximately a third of a second, the ventricle squeezed 70 milliliters of blood approximately into the aorta. That's a lot for a small period of time. So all of it doesn't just shoot straight down the aorta. The aorta actually expands to accept all of this blood. As soon as that semilunar is closed and the blood is not spurting and keeping the pressure on the aorta will constrict. It will pull back to go back to its original shape. As we learned from Poiseuille's law, when you decrease the diameter, you increase the pressure 16-fold. So when it constricts and comes back to its original shape, although there's not blood still squirting into the aorta from the ventricle, you see an increase in pressure for a small blip. And that increased pressure is known as the dicrotic notch. And it happens as the aorta or the artery snaps back into place after receiving the full force of the blood, the 70 milliliters, which causes the distension. Once that is back in place, the pressure in the artery will then drop back around 80, and it will come back and start the cycle all over again. These are the three rings of the cardiac cycle, and this is the way that they work together with the pressures.